Good evening, everyone. My name is Dr. Jocelyn, and I specialize in the field of urology. It's a pleasure to be with you today. We often discuss men's health from a purely medical perspective, focusing on surgeries, medications, and the latest technologies. But today, I want to step back and share a piece of profound yet deceptively simple wisdom that has been overlooked by countless men in my practice. The title of our session is intriguing: Urology Hacks, the secret of an older woman that improves men's health. I can sense the skepticism. What can the wisdom of an older woman possibly teach modern men about the complex anatomy and potential issues of the male urinary tract? The truth is, some of the most powerful insights into long-term health come not from glossy medical journals, but from basic, time-tested habits, the kind of habits that ensure longevity and well-being across generations. In my years of practice, I've noticed a persistent trend. Many men ignore subtle symptoms and delay adopting basic preventative measures until a serious problem like kidney stones or a severe infection forces them into my office. They often neglect the very foundation of urinary health, which ironically is often the easiest thing to control. The secret I am referring to is not a costly supplement or a complicated exercise routine. It's a core principle of maintenance that this particular elderly woman, one of the healthiest patients I've ever encountered, practiced religiously. It's a simple daily routine that focuses on internal cleanliness and bladder discipline. This principle is something you can implement literally starting tomorrow, and it has the power to drastically reduce your risk of common urological issues, from bladder irritation to chronic discomfort. Get ready to learn the fundamental hack that every man needs to know to keep his system running cleanly and efficiently. Let's dive in. The very first and perhaps most critical key point, the cornerstone of this older woman's health regimen, revolves entirely around hydration. This might sound overly simple. We all know we need to drink water, but the wisdom here lies in the strategy and the consistency, not just the volume. She understood intuitively what modern urology confirms. The urinary tract is a self-cleaning system, but it needs a constant, mild flow of fluid to operate optimally. Neglecting this foundational requirement is the most common error men make, often substituting plain water with diuretics like coffee, tea, or sugary soft drinks, which actually accelerate dehydration and concentrate waste products. The secret is not to chug a massive bottle of water at the end of the day, hoping to catch up, but to maintain a gentle, steady drizzle of fluid throughout your waking hours. This strategy ensures that the kidneys are always working efficiently, constantly diluting the minerals and salts that can aggregate to form kidney stones. More importantly, for bladder health, continuous light hydration means that the bladder is gently rinsed multiple times a day. This steady turnover prevents bacteria, which naturally enter the urinary tract, from settling and multiplying, drastically lowering the risk of urinary tract infections, UTIs, that men, especially as they age, become susceptible to. The practice she advocated was carrying a water source at all times and taking small, frequent sips, rather than gulping down huge amounts. Gulping leads to quick elimination, stressing the bladder and often resulting in trips to the restroom without sufficient contact time for filtration. The slow, methodical approach allows for maximum absorption and efficient filtration by the kidneys. Furthermore, this deliberate hydration practice serves as an immediate diagnostic tool. If the urine is dark yellow or amber, it's a clear, instantaneous signal that the body is screaming for more water, a signal often missed or ignored in the hustle of daily life. The goal is consistently pale yellow urine, a simple visual metric that serves as a constant, non-negotiable health check. By prioritizing this consistent, mindful intake of water, men are engaging in active daily prevention against the most common and painful urological ailments. The second crucial element of this overlooked wisdom focuses intently on the discipline of elimination specifically, the critical importance of respecting your body's signals regarding urination and managing the associated pressures. Many men, driven by busy schedules, professional demands, or even just habit, develop a detrimental pattern of consistently delaying urination. They consciously hold it in, often for hours, prioritizing a meeting, a long drive, or an unfinished task over the immediate needs of their anatomy. This act, while seemingly harmless and convenient in the short term, places significant and unnecessary strain on the bladder. The bladder is a muscular organ, and when it is overstretched repeatedly, its muscle fibers can weaken and lose their elasticity over time. This chronic overdistension can lead to a condition known as bladder muscle fatigue, which impairs its ability to fully contract and empty itself efficiently when you finally do go to the bathroom. Incomplete emptying leaves a residue of urine behind, which is often termed post-void residual volume. This residual urine is not sterile water. It's a warm, stagnant pool rich in electrolytes, cellular debris, and potentially small numbers of bacteria. This environment creates a perfect incubator for the growth and proliferation of microorganisms, dramatically increasing the risk of urinary tract infections, UTIs, a condition often mistakenly associated primarily with women. Furthermore, concentrated, stagnant urine allows dissolved minerals to precipitate and aggregate, significantly contributing to the formation of kidney and bladder stones. The older woman's secret acknowledges that the bladder's health is intrinsically linked to its ability to cycle efficiently. Her instruction is simple. Treat the urge to void as a non-negotiable directive from your body. It is an immediate cleaning cycle that must be completed. This isn't just about emptying the bladder. It's also about how you empty it. The practice encourages a moment of mindfulness, ensuring that when you do void, you take the time to fully relax the pelvic floor muscles and allow the bladder to empty completely without rushing or straining. Rushing this process can also lead to residual urine. The discipline extends to preemptively using the restroom before long periods of potential restriction, such as before boarding an airplane, starting a 2-hour meeting, or beginning a long commute, rather than waiting until the bladder is painfully full. By consistently honoring the signal and emptying the bladder fully, men maintain the muscle tone, flush out accumulating toxins and bacteria, and prevent the unhealthy stagnation of urine, thereby avoiding a host of long-term urological complications linked to poor bladder management. This basic, respectful response to the body's signals is a profound preventive measure, rooted in common sense but powerfully effective, one of the most practical and often ignored lessons in long-term urological health, a cornerstone of the wisdom shared by those who live well into their later years, revolves entirely around what you put into your body. We must recognize that the bladder, though a muscular organ designed for storage, has a highly sensitive lining, much like the delicate lining of your stomach. And when that lining is repeatedly assaulted by certain chemicals, it becomes inflamed, overactive, and generally unhappy. This leads directly to two of the most common complaints I hear in the office: frequency and urgency. The most notorious culprits in this systemic irritation are, predictably, caffeine, alcohol, and foods that are either highly acidic or intensely spiced. Caffeine, found in high concentrations in coffee and many. Soft drinks acts as a dual threat. It is a potent diuretic, meaning it rapidly increases urine production, and it is a direct irritant to the bladder wall itself, causing spasms and the sudden, compelling urge to urinate. Alcohol compounds this issue, again acting as a diuretic that forces the kidneys to overwork, while simultaneously dulling the communication between the bladder and the brain, leading to poorly managed storage and emptying cycles. The secret of the older generation and the essence of this particular hack is the disciplined practice of recognizing and mitigating these irritants long before they cause chronic symptoms. They understood that consistent exposure to things like highly acidic citrus juices, tomatoes, vinegar, and certain artificial sweeteners can cause low-grade, persistent inflammation, which over years contributes to conditions like interstitial cystitis or simply chronic overactive bladder symptoms. It's not about absolute elimination, which for many is impractical, but rather about thoughtful moderation and replacement. The core advice here is to adopt a rinse and temper strategy. For every cup of coffee or alcoholic beverage you consume, you must immediately follow it with an equal amount of plain, clean water. This helps to dilute the concentration of the irritant compounds as they pass through your kidneys and bladder, reducing the caustic effect on the delicate mucosal lining. Furthermore, if you are experiencing nocturnal urination or sudden urges, the first place to look is at your late afternoon and evening intake of these substances. By simply cutting off caffeine and alcohol after 5 p.m., you give your bladder the chance to calm down and achieve a restful state. A simple measure that is often more effective than prescription medication. This proactive dietary stewardship is perhaps the most profound non-pharmaceutical step you can take toward ensuring your urinary system remains robust and obedient as you age. Shutterstock. The fourth key point, listen to your body, is perhaps the most crucial element of the older woman's wisdom and challenges a deeply ingrained cultural tendency among men, ignoring symptoms. This proactive attention to internal signals goes beyond simply feeling thirsty or needing the restroom. It involves establishing a baseline awareness of what is normal for your body and reacting swiftly and intelligently when something deviates. Men are often conditioned to power through discomfort or dismiss subtle physical changes, especially those related to urinary or reproductive health, viewing them as minor annoyances or signs of weakness. This delay can have significant urological consequences. For example, a man might notice a slight increase in the frequency of urination, a minor burning sensation, or a change in the color or clarity of his urine. In many cases, he attributes this to drinking too much coffee or simply getting older. However, these minor shifts can be early warnings for conditions like a developing urinary tract infection, UTI, the onset of benign prostatic hyperplasia, BPH, or even the formation of kidney stones. The Older Woman's Secret emphasizes that ignoring these early whispers allows minor issues to escalate into painful, complex, and potentially life-threatening diseases that require aggressive intervention. By contrast, immediately noting and investigating a persistent, subtle change, such as a stream that feels weaker than usual or consistently waking up twice instead of once at night, allows for a timely diagnosis. Early detection of BPH, for instance, means management through simple lifestyle changes or medication rather than waiting until the condition requires surgery due to complete obstruction. This listening process transforms the man from a passive victim of illness to an active participant in his own health maintenance. It requires overcoming the fear or embarrassment often associated with discussing urological symptoms and understanding. That prompt consultation with a specialist upon noticing an irregularity is not a sign of hypochondria, but a mark of responsible self-care. The true life-changing power of this key point lies in its ability to prevent the small problem of today from becoming the medical crisis of tomorrow. The fifth key point, proactive versus reactive care, encapsulates the essence of the older woman's wisdom by framing urological health not as a problem to be fixed once it becomes severe, but as a daily, ongoing practice of maintenance and prevention. This mindset fundamentally challenges the way many men approach their health, which is often characterized by a tough-it-out attitude and a tendency to wait until symptoms become debilitating before seeking medical attention. The proactive approach, in contrast, involves making consistent, small choices every day that collectively safeguard the entire urinary system. It's about being an active participant in one's own well-being rather than a passive observer waiting for things to go wrong. For instance, Being proactive means consistently monitoring your hydration levels to ensure your urine is a pale yellow, thereby actively preventing the concentration of minerals that can lead to kidney stones. It means prioritizing bathroom breaks, even during busy schedules, to avoid bladder distension and the weakening of bladder muscles, which is a common reactive behavior that can lead to long-term issues. Reactive care is costly, stressful, and often requires invasive procedures. A person only reacts when they are experiencing pain, burning, or frequency issues. Proactive care, however, is cheap, simple, and empowers the individual to maintain peak function. The older woman's secret isn't a cure for existing ailments. It's a blueprint for avoidance. It teaches us that the habits of adequate water intake, timely voiding, and avoiding irritants are not just minor suggestions, but powerful protective measures. By adopting this outlook, men move away from crisis management and toward sustained optimal health, recognizing that preventative maintenance is always superior to emergency repair. This shift in perspective transforms urological health from a dreaded possibility into a routine matter of daily self-care, ensuring the system remains clean, strong, and functional for decades to come. So, here is the final truth. Learned not from a complex algorithm, but from pure, simple living, the greatest urological hack is consistency. You now know the secret. It's not about expensive gadgets or complicated treatments. It's about respecting your body's most basic, vital needs daily. Stop treating your bladder and kidneys like an afterthought. Stop waiting for the pain to begin. Be proactive, be consistent, and reclaim control over your health. The choice is yours. Will you continue the cycle of reactive care, or will you embrace this simple, life-changing wisdom today? Start that hydration habit, listen to your body, and never hold back. Your future self will thank you for taking this profound, simple step. Thank you. If you're serious about your health, make sure you subscribe for more expert advice.